Yeah, so my name is Wesley Jones. I'm the area CEO of the Springs Health Center. The Springs Health Center is a skilled nursing facility, um, which is different from like assisted living or a boarding care. We're a healthcare facility where we take patients generally in from the hospitals, the local hospitals, who need rehabilitation, strengthening. They may need medical management, and we get them stronger, safe to go home. And once they're ready to go home, we have a discharge plan and we get them back to their prior level of living function. So yeah, so we also have a section of our facility that is going to be dedicated to what we call long-term care. These are residents who are not going to be able to go back home for one reason or the other. Maybe their health is in such shape that they can't. There's no family or resources at home to care for them, and so we can take them in under what we call long-term care. Our facility is 170 beds, so it's a large place. So we did that purposely so that we can also take in long-term care residents along with short-term care residents. What makes us unique as a center, first of all, you rarely see new skilled nursing facilities being constructed in California, specifically in Southern California. It's very rare. So the fact that we're a brand new constructed nursing facility is quite unique, and the reaction we've got shows that it's very unique. But what's also unique about our center is that we are big. We're 170 beds, so we can have long-term care patients, we can have short-term care patients. We will also be opening in about a year, as part of those 170 beds, a subacute unit, which is a higher level of care than skilled nursing, which again, there's not a lot of places around here that can do that. And so we really feel like we're serving a need in the community that is underserved. Yeah, so when we looked at where we wanted to build a healthcare center, Murrieta stood out because for one big reason, the lack of skilled nursing facilities in the area. Murrieta, Temecula, there's 4 local, plus Wildomar, 4 local acute hospitals, and there's only 1 skilled nursing facility currently in the area. And we got a lot of feedback down here that patients from the hospital are having to go to different communities, Hemet, Riverside, sometimes down to San Diego for skilled nursing care. And so we felt this was a great opportunity to come in and again serve an area where there's a huge need. But we foresee this being the premier skilled nursing facility in Riverside County. Our priority is to serve the local population here, but we anticipate people coming from distances in Riverside County just to experience our facility. Not only because it's a new construction skilled nursing facility, which, like I said earlier, is very rare, but it's the way it's designed, the staff we have here. It's really a great place for people who need to recover and get therapy, get stronger to go back home. So we really anticipate making a huge footprint. We have a lot of relationships already with medical groups and hospitals in the area, and they're really excited for us to open and get this thing started. Yeah, so one of the wonderful things about opening this health center has been the reaction of the local workforce. We have found that there's so many people in Murrieta, Temecula that commute a long ways to work in a healthcare facility. We've hired, we don't even have very many residents right now, but we've hired about 100 employees already. And this is off the top of my head, but I've got to imagine 60 to 70% of them have been commuting down to San Diego, up to Riverside, into Orange County for their jobs, and now they're able to be here in a 5-10 minute commute. So that's been fabulous to have this workforce that's so local. The relationship we've had with Murrieta, we've hired marketing team and we have different people out in the community, but the relationship with the city of Murrieta has been incredible. They've been very helpful in moving the construction along and supporting us with the Department of Health, with different agencies that oversee the construction of the facility. We've had great support from the fire department, the police department, City of Chambers. The economic development group here in Murrieta has been fabulous and really embraced us and connected us to a lot of people in the community, and that has been wonderful for us as a startup company, startup facility in this area. The thing that sticks out to me about this community is just kind of the entrepreneurship, partnership. It seems like everybody's on the same team down here, all fighting to improve and working together to improve the healthcare down here. It's really exciting to see as we go to these meetings with economic development and see the emphasis that's being put on healthcare in this community with new hospitals being built, new research centers. I think it's a great place to build this industry of healthcare in Murrieta.